So, John, what do you think of that? Why are some people not able to get to goal? Uh, what do you do? When do you recognize that somebody needs more than insulin or needs a completely different approach?
That's a great question, Vivian, and I'm sure we'll get to this in a minute. But I mean, the first thing that comes to your mind about this is the first thing is safety, right? I mean, we have to figure out a better way of treating her and minimizing or at least markedly reducing her risk for hypoglycemia. She's already had one episode of what one would call severe hypoglycemia and a trip to an emergency room. And so we have to look at that basal insulin dose, and in this case she's at 0.73 units per kilogram, and I know you're going to cover how we look at that 0.5 units per kilogram number. And the other thing is, this is what happens in primary care. They continue, clinicians may push the dose of basal insulin because they say, well, we finally got her fasting down to 118, but she's still not at goal. Well, let's just keep pushing, when they fail to realize that you really have to address that postprandial component. And I think this patient's A1C, was 13 months ago was 7.2%. Now it's 8.2%. So clearly, one of the things we need to do is let's measure something other than fastings, and let's open our eyes after meals, particularly after that evening meal, and see where we are heading to bed, because that'll inform us on how we go forward.
Thank you. So this is a common problem. People are taking insulin, taking high doses of insulin. Their fasting glucose is normal, but they are still not getting to goal. And we need to recognize that this further subtitration is not going to help. It increases the risk of hypoglycemia, which is a common scenario, particularly as you get above 0.5 units per kilogram,